Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Rudmila Rahman, the founder and CEO of Viv Health. Rudmila's journey is anything but ordinary. With a background that spans from investment banking at Barclays to strategic roles at MetLife and the old World Bank, she has a deep understanding of financial and strategic landscapes of global industries. Her career then took a pivotal turn into the heart of tech world with leadership positions at Amazon and Amazon Web Services, where she focused on corporate development, strategic partnerships, and the growth of AI and machine learning technologies. Now, Rudmila is channeling her vast experience and passion for innovation into solving some of the most pressing challenges in healthcare. As the founder of Viv Health, she is on a mission to make quality healthcare more accessible and personalized for women everywhere. We are thrilled to have her with us to discuss her incredible journey, the innovative work being done at Viv Health, and her vision for future of health tech. Welcome to Health Tech Heroes, Rudmila.
Hi, Fasa. Great to be here. Thanks for having me, and I'm excited to have this chat.
And it's my pleasure to invite you. And just for the records, I think you are my first guest who I have met personally before the podcast. So welcome
a couple times here in Los Angeles.
A couple of times, yeah. Your career path is incredibly diverse, from investment banking to leadership roles at tech giants like Amazon. Can you share a pivotal moment or personal story that inspired you to leave the world behind and venture into challenging and deeply personal space of healthcare?
I've done a lot of different things and lived many lives, but I think the common thread has been I've always been motivated to go into domains that actually fix problems that I've suffered through or problems that people in my communities have suffered through. So going all the way back, I was born and raised in Bangladesh, and I moved to the US when I was 18 for college. And earlier in my career, solving personal problems meant solving problems around economics, development, financial services that really shaped how I grew up. But in the back of my mind, healthcare had always been something I'd struggled with. Going back to even earlier than that, when I was 16, I had a couple different healthcare issues. I woke up in the middle of the night one night with crippling cramps that lasted for months, and I bounced from doctor to doctor at the time. During that process, I moved away from home in Bangladesh to the US, and I finally thought I'd, get the care I needed. But unfortunately, it took me about 20 years since then to really get diagnosed with this OB-GYN condition that I'm dealing with. And doctors had kind of dismissed my pain, said it's probably just stress. And I had to DIY a lot of my own treatments, like most of us do from Google and Reddit and things like that. And when I finally got the diagnosis, I felt a massive weight off my shoulders and got some answers. And it also got me thinking about what we could do better in this space, like why that happens, what I could do as a tech builder and someone who's super curious about different spaces to go in and fix it.
I'm glad that you are able to do some DIY, but not a lot of people have that luxury of doing and the inclination to do so. And I'm glad that you're doing what you're doing to help those patients. Founding a company, especially in field as complex as healthcare, is a monumental undertaking. What was the specific problem in women's health that you felt so passionately about, and you knew you had to create Viv Health to solve it? You alluded to that specific problem, but if you can double click and get a little bit deeper into the problem itself, it'll be really helpful.
What I had faced was inequity in the space, and it doesn't have a really clear explanation. When you look at just the US itself, about 35% of women are skipping and delaying care because of these problems, and OB-GYN doctors aren't able to keep up with the demand. There just aren't enough of them. There's one for every 2,600 women. So on both sides, everyone's getting squeezed. And that issue was really plaguing, I think, what the outcomes that I was seeing in healthcare was. And that's the problem that I personally am on a mission to fix. And I think Viv is starting to deal with a little bit of that, where can you make the patient-provider experience better as a whole in order to then impact the outcomes that come down the line?
Is OB-GYN specialty is squeezed more so than other specialties, or how does it stand when it's compared to other specialties?
Absolutely. It is. Because if you think about that, OB-GYN, if you think back historically a little bit, OB and GYN are two different things. OB is obstetrics, gynecology is everything else that is not delivering a baby, which is the entire course of
Okay.
a woman's life. And way back, I think 10, 20 years ago, what medical schools did was they combined both of those rotations into one. So doctors became specialized in OB and GYN. So you took everything about a woman's body, including the birth aspect of it, but everything from puberty to contraception to STDs to menopause to heart health and bone health, and you put it all in the same specialty. That really hasn't happened anywhere else. And then that specialty goes and deals with half the population of the world. So these doctors are just, their scope is so broad. They're more slammed than any other doctors I've seen. And there's problems around, a lot of them are retiring because of these issues. Not very many people are wanting to go into this space. And those that do go in, they just have such a big patient load that it's hard for them to look at a patient experience when all they're trying to do is to make sure that women and babies are delivered in a healthy way. So I think we're doing a disservice to the industry and the providers that practice it by asking so much of them without giving them the right tools to be able to deliver on it.
And that was it's probably a common knowledge for a lot of people, but for me, it was very revealing that, now you're taking two specialties and putting it together, and that itself is an issue. Looking back at your journey, what did you say was the biggest leap of faith you have ever taken, and what did you learn from that experience?
The biggest leap is really what we're talking about right now. So for me, leaving a big company like Amazon and jumping into the unknown with healthcare, which is such a hard space, was the biggest leap. I don't know if you also resonate with this, but as an immigrant coming to a different country, you think about stability and security and being plugged into an ecosystem as the way to do things. And when you're starting a company, you basically rip out all of that. And then what I'm putting in instead is this highly regulated, very complex industry with a lot of minefields. So I think for me, the biggest leap is trying to understand, can I do this? Is the problem big enough? Is the solution I have the right one? And I think the answer to all those questions is yes, which is why I'm doing it. But it's definitely been a journey to get here.
As a person who has extensive technology experience and understanding healthcare, what is that one thing that you learned when you jumped into healthcare that has changed you, say, compared to what you were a year ago?
That's such a great question. The most exciting thing for me about going into healthcare is meeting all the people who have dedicated their lives to this because they're just such good people. And when I compare them to other industries I've worked in, everyone really wants to help. Like you get into healthcare because you're mission oriented and you really want to help other people. And as a founder, I found people that I don't know rooting for me and giving me time and their expertise, and just found that healthcare providers especially are motivated by a true desire to make that difference in someone's life versus other industries where I think the incentives are just very different, where you don't face people and their problems as closely. So I've been in big tech before this, Amazon Web Services. We were building kind of fundamental infrastructure for computing. So you're not really meeting your end customer in that kind of way. Before that, I was in financial services. Again, very kind of abstract space where you're building these tools that move numbers and data around, and you're not meeting that end customer who is let's say, the beneficiary of a loan that a bank is giving, or the person who's, making a credit card payment, or a bank that needs cross-border transactions. You're not meeting those people. But in healthcare, you are constantly confronted with patient needs. And I think what's really been that insight for me is how much people who are in this space really care about that aspect.
I think in a way, may not be 100% true in either way. You are coming from Amazon, so there is the concept of one-way door and the two-way door. And
Yeah.
in healthcare, I think it's for the patient, it is one-way door, makes decisions, and it can have such a big impact that you
Absolutely.
cannot take it away. But in other industries, they're usually a two-way door. Would you agree with that?
That's a really interesting framing. I don't think I thought about that before, but you're absolutely right. Healthcare, once you institute some sort of change, if you change a workflow or you change a protocol, you are immediately going to impact someone in a real, serious way in their lives. And if you don't do that right, it's a major problem. You can't reverse it. You can't reverse time. I think there could be some similarities in financial services. So I think a lot about how fintech and financial services also maps onto healthcare and health tech a lot. And I think both are very highly regulated spaces. And in one, you're dealing with people's money, and the other, you're dealing with people's health. Like there aren't things that are any more important than that to most people on a day-to-day basis. So there's similarities there. But with healthcare, you also don't want to set a precedent where if you do things in one way and you're saying that, hey, this is the way that I think is better and superior, that then sets a precedent for everyone that comes after you to look at that, to stand on your shoulders. And you have to take that responsibility really seriously. Many of the companies that I look up to as models, like they've done a great job doing that. And I feel confident as a founder in working with that in that ecosystem.
Thank you very much for that. So we understand that there are many challenges. The challenges are huge. Let's see how Viv Health is trying to solve these challenges. And for our listeners who may not be familiar with your company, could you introduce Viv Health and share its core mission?
Viv Health is an AI autopilot for providers that specialize in women's health. So we are really building software that's making the routine tasks of providing medical care much easier, much more automated. And we're doing it specifically for hundreds of women's health conditions that these OB-GYN doctors are dealing with. So, for example, if you're a patient and you're messaging in, we can intercept that message and we can essentially do screening and triage of the condition that you're reaching out to your doctor for. Urgent cases get escalated to human care and routine ones get dealt with autonomously. And at the end of it, we're also able to automate follow-ups and check-ins that your doctor would do. And what happens is fewer patients fall through the cracks and doctors are burning out less because they're not stuck behind their desks answering hundreds of messages and tasks. And they're essentially doing a better job at being doctors and doing what they are trained to do, which is provide more medical advice. So by helping doctors with software, we're able to eventually help them with their jobs and also patient care. And I think we can only do this right now in this day and age because AI, generative AI, the form that we're using exists. And I don't want to say that this couldn't be not be done without AI because that's absolutely true. You could do this with classic technology. It's just a lot harder and more expensive to do because what you have to understand is you have to understand all the different hundreds of different care pathways that a woman can go through when she has a disease or a condition in the OB-GYN space. And you have to be able to adjust and make sure the right care team member deals with that concern. And without something like AI that adjusts automatically, that can generate novel new information, can explain things quickly, it's just a lot harder to do. So I think we're in a really interesting time where we could use what's out there to apply that in a space where technology has just kind of been missing for a long time.
So the next question is, can you elaborate on how this technology works and how it is making a tangible difference in quality and accessibility of women's health? Very specifically, if we can double click on the fact that there are a lot of generic AI solutions that are coming up, why Viv Health is so important in this space, in this setting. What is one or two use cases where Viv Health is going to help directly in women's healthcare where the generic solutions can't? Can you give us a couple of examples like those?
I'll start with the examples. So one thing is every woman goes in for an annual well woman exam. So when you go in for this annual gynecological exam, you get something done which is called a pap smear. And that is a test to make sure that your cervix is healthy. And you go get that test and you sometimes get results that are abnormal. So clinics and hospitals do hundreds of these tests every day. And sometimes you get abnormal results where the patient sees it and they freak out. They're like, oh my God, do I have cervical cancer? And the answer is no, probably not, because that abnormality needs to be a certain type in order for you to then be asked to go back into that clinic and do some sort of biopsy to test if you have any cancerous cells there. But what's happening now is that every single patient that does that exam is calling into the doctor, asking for explanations, demanding solutions, trying to understand what the process would be if things escalate. And clinics are getting inundated with messages. We're able to take their results and explain autonomously to the patient where they fall on the spectrum of disease severity. And we're able to triage the patients that are really severe to the doctors where they can then book in a colposcopy, which is the biopsy. Or if it's not severe, we can explain to them, hey, in 3 months, come back and you're due for another test, and then follow up on that. So to ensure that they are not no-shows, because that's another way in which things escalate. So we're basically able to take on that entire prep and triage process for a pap smear in a way that doctors were doing manually before. They were doing through looking at lab results and copy pasting the values onto certain templates and then sending those emails back to the patient, or just manually, just hoping that the patient would call in and ask for answers as opposed to being proactive. So we're basically changing that paradigm, and that's one big example. Happy to go into other use use cases, but I think that highlights what it does, and the underlying technology behind it is a large language model, and it's agents that do the tasks that the large language model recommends to the clinic, and that automates the work. And generic AI tools, to answer your question about how we're different from these generic tools, they're actually doing really great work, but what they're not doing is that they're not tailoring and customizing it to these women's health use cases. And every single use case in medicine is so specialized that they're doing, I think, we're going to get to a point where everyone is specializing more in a specific field. And I think we're just at the tip of the iceberg where a lot of companies have been doing this generic things for a while, and maybe they're going to go into one area. But what I'm doing and what we're doing at Viv is just jumping right into the specialized area as soon as possible so that we can get the data and the information on how these workflows work before we expand.
That's a really good example. And this is a generic tool, cannot get into the details because the amount of data they're going to collect with 5 different settings is going to be 1/5 of what you will be collecting. So the data is going to drive precision and improvement as we go forward. And the other question for you is just out of curiosity, mm, when we automate this and we send out this email to the patient, is there a human in the loop process here?
That's a great thing to call out, actually, because I think I strongly believe that humans, meaning doctors, providers, nurses, they still need to be in the loop in a lot of these things. So what we do is we usually summarize a chat log where the patient has been asked questions and they've answered, and we show that summary to the doctor so that they're prepped faster to do their visits. And before any medical recommendation goes out, before any prescription goes out, there's always a provider in the loop in order for them to supervise it. So I think that's really important for that to be the case. There are companies that are doing this in a lot of really interesting ways. Some are automating 90% of it and the provider is just checking the box. Some are automating 10% of it and the provider is doing most of the care and follow up. I think we sit in the middle, and it really depends case by case on what kind of use case, what condition, what the clinic does. But because we're software, we're not opinionated on how much that should be. We let that choice be up to the clinic, the doctor, the condition, and then we can customize and configure that, dial it up or down, depending on what our customers want.
Like as we collect data, I think there is a scope for dialing it up and making it as easier and easier for the practices, I would imagine.
Also, customer, like patient preference too. There are some patients that come in and they just want everything to be dealt with automated in an automated way. They never want to have to talk to anyone. They never want to have to go into a clinic. And what's an interesting learning for us is that breakdown of patients and what they want has nothing to do with demographics and age. It's not like Gen Z wants to talk less and Gen X doesn't. It actually varies by person. So I think as generative AI becomes more mainstream in medical and healthcare settings, we're going to learn a lot about what patients actually want, and it's going to define what our next set of patient experiences need to look like.
So I see the value for the physicians. I see the value for the patients 100%. How does a payer play a role? Are you dealing with the clinicians and they are the one, or the hospital systems, they are the one cutting the check for you?
The clinics are cutting the check. So the
Okay.
business model is very simple. We're just charging clinics per monthly fee per provider seat. And the value they're getting is that they're seeing efficiencies, they're seeing greater patient visits, they're seeing more visits that are becoming reimbursable because they're more complex in nature, and patients that otherwise would not have even bothered to message are engaging more. So that's the way that clinics benefit. We are not selling to providers yet. Maybe down the line we could be a care navigation tool for providers. But I think my wish list for what payers should do in this space is think about how reimbursements for AI visits would work. And think about what you're considering human effort and complexity there versus AI. And can we figure out a model for AI visits to become reimbursable? Because then it'll be helpful for doctors because they can adopt that technology easily. I think the American Medical Association is having conversations around this. There's some legislation being discussed, but there's nothing, clearly outlined there. And it's hard for founders, I think, when there's a lack of clarity, but there's a really strong demand for regulation in this space.
Yeah, and as far as we have a clear ROI, which we do for the clinics, and I think they will be able to afford to do this, and I think they should, just because the ROI is like such so clear. And the second question regarding that is, when it comes down to patients, do they have this information? Is it a patient's account or is it the clinic's account, right? Do the patients take these records and say they change the insurance and then go to a different provider? Do you assist in that aspect as well, or it remains with the clinic or the hospital?
We plug into the clinic's existing
Okay.
EMR system. So we're not replacing their system of record. So however the clinic typically manages patient data, we plug into that and the patient can extract it from their clinic. Interoperability, you know this better than I do, is really hard in healthcare. I think we as a software company will benefit from the more patients are able to use their data in a portable way and move it from clinic to clinic, because then we don't have to start from scratch. We don't have to start answering their questions from scratch. We can pull that information and we'll have more context. AI operates the best, or it gives you the best results when it has more context. And that context for healthcare is patient data. So I'm hoping that there is going to be a lot more opening up of
Yeah.
that and that we could plug into those tools more easily.
Your previous comment that OB-GYN is a process, it's a lifelong process. It's not an event. And just having that lifelong records in like Viv Health will be so valuable for the patients. But I think that could be a goal and aspiration as we go forward.
Yeah,
It's just the system
absolutely.
is.
And I think you make a good point that lifelong care, that's one of our visions for the future is how can you make care more continuous for patients? How can you make transition away from this episodic one-time care that we only go when we have massive problems to care that is more casual and more like, hey, I had this problem. I'm in the office right now. I'm going to text my doctor. I'm going to get a solution instead of like waiting until you have severe pain to actually go see someone for help.
Can you explain one of the wins that you recently had and you're like really proud of with Viv Health? I understand you're in a very early startup stage. The second also, what kind of challenges are you facing as Viv Health as a startup?
Think about them all the time. So on the win side, you're right. We're super early. We're piloting with some of our partners. One specific partner I'm really excited about, and I won't mention their name because we're still in discussions, is an organization that does amazing work in contraception. So they make sure that contraception and consults are accessible and affordable to women across the US by going into provider practices, training their providers, and also giving them digital tools to make contraception access easier in a remote kind of way. So if a woman comes in or is sitting at home, she can get birth control easily, she can discuss her options, she can figure out what that plan looks like for herself and her family. Typically what happens is when they train providers often don't have extra staff in their offices to train. A lot of providers want to make contraception more accessible, but they don't have an extra nurse practitioner or a medical assistant because these people are hard to get. And when they do get them, the training takes time too. So what we're doing is we're helping this organization turbocharge the existing practices that they're working with by giving them a use case around use Viv for your contraception prescription needs. So a patient comes in, they could chat with Viv to understand what their options are, pros and cons of different contraception options for them. And then eventually, when they do see a doctor, they're way more trained, they're way more prepared, and the doctor can have a higher level conversation with that patient, where then they decide what the next steps are as opposed to just being educational. So I think that'll open up more visits for those providers and also open up an avenue for the organization that we're partnering with to scale more broadly, where they don't have to be bottlenecked by the number of humans that you have to train to do this kind of work.
That's phenomenal. And I would imagine the doctor also knows that what the patient has already learned so that they can immediately meet the patient where they are instead of trying to figure out where they are, right? I would imagine doctor gets to see how much the patient is prepped to. So that's phenomenal.
Yeah,
I think
exactly.
it's very
Exactly.
important. As you pointed out, the doctors can actually have a higher level conversations rather than spending your 15, 20 minutes explaining the basics of everything.
Right. We get 15 minutes with our doctors. We all know that we get a slot on the calendar that is super short, and we have to go in there and we have to make sure we ask them all those questions. We download all that information. Maybe we're taking notes, maybe we forget about it, but at the end of the day, that 15 minutes is oftentimes not sufficient for every single type of patient. And you never know where that patient is starting on their journey of learning about these. We just make it a lot easier for both the patient and the doctor to use that 15 minutes in a much more effective way than they have in the past.
Amazing. All right. Challenges.
I think a common question I get is, and I think anyone building an AI gets, is hallucinations, error rates, how accurate is your models. So we're going through that process where we are learning at the same time that our providers are learning about this. And I think as an industry, we look towards these big model providers and these models that are run by OpenAI, or Google has some great ones in the medical space. There's some open source options too. And we look to them to reduce hallucination rates. And I, as founder, have to go in and explain to our customers what that means and how we're trying to mitigate those things by putting human guardrails in place or doing really good evaluations. But I think the challenge is still there, is that there still is some hallucination, and we have to make sure in a much more classic tech way to reduce that. So that's one set of challenges. I would say that I'm fortunate because one of my medical advisors is an OB-GYN and also someone who's helped these big companies train some of their models, that we keep an eye on that. And our end goal is to make sure whatever care what we help provide meets the same standards as whether AI was in the loop or not. So we keep that in mind. And then I think the second challenge that we have is just trust, which is so important in healthcare, trust from clinicians and making sure that they are using these tools in the way that they're meant to be used, and being able to give us feedback constantly on how they're working and how they're not. And once those two challenges are dealt with, I think from the adoption side of things, we will be able to use Viv in many new ways that I think we haven't thought of already.
If you look at hallucination as a missed opportunity, compared to not having AI at all, is there still a gain? Because we sometimes tend to compare AI to 100% perfection, but the current system is nowhere close to 100%. It could be like 80% or 85% or even 60% in some cases. But AI is bringing it to 95%, but we criticize it for the 5% of hallucination. Is there a gap between how these things are getting done now, and despite the hallucination, that we have a huge gain? Do you have any estimate of those?
That's a great question. I think that's something that I talk to doctors about a lot, is we don't measure what the error rate is in medicine. I mean, medical liability exists for a reason. There is some sort of error. Everyone's human. That happens. It oftentimes happens because of errors in coordination, because of fragmentation of systems and the information data being missed in critical steps, not because the provider is intentionally trying to make a mistake, right? So if I don't have those numbers, I don't know what those numbers are, but my guess would be it would be more than 5%.
Okay.
So if you can get models to 95%, maybe they're at some point they're going to be in a place that where we rely on them as much as we would rely on like a junior medical professional, someone who hasn't maybe seen a ton of cases but has a lot of book knowledge. And if we even get there, I think the case that I can make for ROI positive uses of AI gets a lot easier.
From my perspective, I think AI is going to be pretty good. Doctors are going to be pretty good. I think AI plus doctors are going to be incredible. So I think we already have something to gain just by combining these two expertise. And so, the hallucination is a big challenge. And have you seen any changes within this few months that you have run your models, and things are improving within these few months? And is there something we can hope for?
I keep my eye on Health Bench's benchmarks a lot for all these models, and I feel like every month the models come out and they get higher and higher on Health Bench. Like the hallucinations get lower and the model performance gets higher. We also have to think about the cost of doing these things too. So AI answers don't appear out of thin air. You're actually paying for the inputs and you're paying for the outputs too, which is very different from the typical kind of model of building technology. So in a consumption-based pricing kind of framework, we have to make sure that the most accurate answers happen with the least amount of tokens. And I think that's a balance that is really hard to strike now, because you can have really long answers that are super accurate, but it's also costing a lot of money. And is that what it's costing us? Is that a lot less than a human answering that question? And I think we're going to get there. I think token costs have gone down. Even in the last 2 years, they've gone down 10x. Right now, there's a discrepancy between input costs and output costs. That's also 10x, where the outputs cost a lot more than what it costs to make a question happen. So I think we're trying to figure out how to balance that in a way where we could still be sustainable and also get super accurate answers.
And that brings us to the future of AI and healthcare. So right now, you gave a really good picture of what's happening, like month by month. So where do you think it's going to go in like a year or 2 years? I think 5 years seems like 500 years in the life cycle of AI. But what do you think it's going to be like in a year or 2 years? How is this space going to look from an AI perspective, technology perspective?
If I think back to maybe 2 years ago was when I started exploring ideas for this company, we weren't even talking about the uses of AI in healthcare. We were still trying to figure out, can we trust these models to give us recommendations for where to get the best pizza in our city? And now we're talking about, can this model diagnose cancer earlier than, a radiologist would? So it's just phenomenal how much has changed in 2 years. So it's so hard for me to predict where we're going to go in the next 2 years. My wish for where we go is getting really crisp on the use cases and how this can help. My mission is to help women more. Women's health has been an area that has been chronically underinvested in. There hasn't been a ton of research. I think most people in the space know the stat that we didn't start requiring clinical trials include women until the 1990s.
Yeah.
So the length of data, longitudinal data that we don't have on women's conditions is just not sufficient. So even if we took all that data and tried to train these models with it, we still wouldn't get to the right level that we need to really advance the space. So my wish in the next 2 years is for us to look at that, for researchers to look at where the big pockets of gaps are in model knowledge for certain domains, and to be able to plug that in ways that go out to help people in that space. So that's where I want to get to in 2 years. And I think with all the work that is going on.
Oh, well, yeah, for sure. Recruiting women in clinical trials has been tricky. You want younger population, then also they should not have intent of bear a child, and so it kind of makes it really complex to make that. And then we have low representation of person of color, and now person of
Absolutely.
color, and combine that with women, then there is like very sparse data too. The next question for you is, this is an interesting question. This is focused on you. I don't think I've asked anybody this question because I think you might be in a good place to answer this. Say, let's put AI technology and getting mature at 365 days. It's one full year of the whole life cycle of AI. Where do you think we are right now in this life cycle of development with AI since the call of ChatGPT, for example, the first model that came out of ChatGPT? Since then, are we on day 1, day 2, 3 months down? Where do you think we are?
Wow, that's a really great question. I don't even know if I'm the right person to be asking here, but I can tell you what I've been following in the space. I honestly think we're still at day 1. The changes and the inventions and the discoveries have just been so phenomenal. Like, they discovered that if you throw data at models and you keep on scaling the compute and you keep on pushing it, you get these amazing results. What we don't know is we can't explain why those results happen. It's a black box still. So I think in order for AI to really unlock the trust and the kind of credibility it needs to spread across all these spaces, especially in healthcare, we really need to understand explainability. So I keep my eye really closely on the papers that are coming out and the amazing research that AI companies are doing in the explainability space. A second area that I think we're still at day 1 is in multimodal AI. So right now we do a great job in text. We're doing some in video, audio's coming out. But when you think about the human experience and how we interact with technology, it's all these things. We're chatting with it, we're sending pictures, we're talking, and no other industry is more, that's super relevant to healthcare, because that is the entire, if you walk into a consult, you're doing all these things. You have paperwork that you fill out when you begin, you talk to your doctor, or you do telehealth calls. They're listening to what you're saying, that's getting recorded. Like, there's so many different modalities. So I think we really need to have a multimodal system that can take all of that and then spit out the right answer. And I think there's research also being done in that space too, to get away from just the form factor of text or just the form factor of voice into something that's more holistic. So I think that's where I keep an eye out for.
I have to wholeheartedly agree. That's how I feel too. It's day 1 in a scale of 365 when it comes down to AI. And I don't know, we might be in first hour when it comes down to healthcare and AI space.
Absolutely. It's
Yeah.
like the inception point, like day
Yeah, yeah.
1, like the
The,
world
or,
happens and then we're not
or,
close to the end.
or the first 10 seconds of the Big Bang. We have no
Exactly.
idea what's going on there. And you have successfully navigated both corporate and startup worlds. What is one piece of advice that you give to aspiring entrepreneurs and leaders who are looking to break into this health tech industry?
Advice I can give is for people outside of healthcare who want to come into healthcare. I talk to hundreds of people. I talk to tech builders, I talk to payers, providers, executives at healthcare companies. And I think that really helped me learn and shape my view of what I wanted to do that was different in the space. So I'd absolutely recommend that. But what I would say is also take that advice with a grain of salt, because a lot of times the advice I got was what doesn't work in healthcare. And as an entrepreneur, you cannot get disaffected about an industry based on what doesn't work. And what people who have been in an industry for 10, 15, 20 years will oftentimes focus on is that, because they really care. And it comes from such a good place of frustration. And it's like, I want to make sure you avoid all these pitfalls. But sometimes that can take up the entire conversation. And what I have done is making sure that they see what I see as the positive. Like, I see so much positive and potential for healthcare. I see a lot of things. And I see all these problems as opportunities where we can solve, and we really that open up big markets and reasons to build. So if you're able to explain that to the people that are giving you advice, you can shift the tone of that conversation away from pain and frustration to possibility and things that are optimistic. And I'd really encourage entrepreneurs to focus on that and focus on the possibility for every single conversation you're having.
Terrific. And thank you very much for that advice. I've asked multiple questions throughout this podcast, and we covered a lot of ground. But if there is something that I might have missed, or you think that it is really important, something that is really important that you want to reiterate, you have 90 seconds. You can take more if you want, Rudmila. What is that one thing that you want the guests or the listeners to hear and give them advice? Or if you want to pitch Viv Health, that's perfectly fine too. So whatever it is, the 90 seconds, the question is yours, the answer is yours, and the stage is yours.
Thank you for that. That's a great opportunity to tell people to come give us feedback as well. So check us out on meetviv.com. We are looking for people that can help us on the technology side. We are looking for partners who are OB-GYN doctors, clinicians, people in healthcare systems to go to work with and help you achieve what you want to achieve. But I think for what I do want to add that I haven't said already is that we talked a lot about AI and technology, but healthcare is still such a people business. And you really have to like working and getting really deep into those workflows. And you can't build the AI and you can't build the technology until you deeply understand the problem. So I spend a lot of time sitting next to doctors, looking at their workflows, looking at how they do things. And it is so important for entrepreneurs to do that before we even get into the discussions around how AI can automate those workflows. And that makes for a less exciting podcast, I think. So I like what you're doing as you're focusing on the opportunity and the technology, but I want to make sure that, people understand that where we spend our time and where I think the most time our resources need to be allocated is really in the weeds of everything and in the guts of the system. And that's what I love doing. So, if there are listeners out there that feel the same way, I'd love to connect with them.
Yep. And thank you very much for Rudmila for that. And I'll be totally open to double-clicking on the conversations that you have had with the industry and what were those specific learnings. And we can have another conversation about this. I'm open to this. And that means you are also invited to another podcast if time and opportunity dictates it. But with
That's
that,
great.
Thank you very much for being here today at my podcast. It was a privilege.
That's great. It's been awesome to meet you, to get to know you in the ecosystem, Fessa, and really great to be here and to be able to get a platform to talk about Viv Health.